What's up, veterans? VA Disability Guy here, back again with a video you don't want to miss. But before I get into today's content, I know I've been gone for almost, a month and a half, and I haven't uploaded a video. I apologize for the break, but I needed it. It's not a secret that I do suffer from some mental health issues, and they're based off of some traumatic events that happened to me in my past. And because of that, there are times where I honestly don't feel like doing things, even things that I'm passionate about. I'm good right now and I'm back. So, with that being said, I do want to apologize once again to the folks that have had comments go unanswered and things like that, just based off of my absence. Now, today's video is going to be about COVID and if the VA will give you VA disability for it. The short answer to that is kind of a no, but kind of a yes. The reason I say that is because though the VA does not give a rating, they don't have a rating schedule for COVID specifically, they do have ratings for symptoms of what's called long COVID. So today's video is going to be about what long COVID qualifies for, or at least the symptoms, what long COVID symptoms qualify for VA disability. So, as usual, if you're new to the channel, go ahead and subscribe. There's no better time to do it. It takes a few seconds. And be sure to hit the notification bell. That way, whenever I upload videos, you'll be one of the first people notified. Also, if you like the content that I provide, leave a thumbs up, hit the like button. Interacting with the channel in these ways lets the YouTube algorithm know that the information that I'm providing is important, and YouTube will push these videos out to more veterans like yourself. Oh yeah, there's also one more announcement that I want to make. The channel has been growing and I appreciate every single subscriber, but I will honestly say it has been very hard to keep up with all of the comments. With that being said, I have been considering opening up my personal phone line to have consultations with those of you that need quick answers on things. So I'm thinking about it, and it's still something I'm considering. I'm thinking about opening up my personal email so that you all can reach out to me with some questions, no more than 5, and then having an actual phone conversation with you all and answering those questions for you specifically. So definitely something I'm considering. If that's something that any of you would be interested in, leave a comment and just say, hey, looking forward to a phone call with you or something like that. And that way I can get an understanding of how many of y'all actually would want that service. And then I can consider adding that into my busy schedule, because like I said, I hate that I'm not able to respond to all your comments because it does take a lot of time and typing is slower than actually having a conversation. So with that being said, let's get into today's video. So let's talk about VA disability and COVID specifically. All right, so pretty sure the question that you all are asking is, can you get VA disability benefits for COVID? And as I said earlier, the answer is yes, but also no. More so no than yes, because as you can see, when it comes to COVID-19, the answer depends on when and where you got COVID and how the illness affected you. While getting COVID-19 isn't normally enough to qualify for VA disability benefits, veterans who become ill with COVID while on active duty and suffer from other medical conditions, especially long COVID, which I've said earlier, as a result of their exposure, may be eligible for VA benefits, including disability and medical care. But let's talk about it. So what exactly is long COVID? Long COVID is the name given to any of several symptoms that affect those who have been ill with COVID and recovered from the main illness. These new symptoms can develop anytime after the initial infection, usually within 1 to 3 months. They can also persist and sometimes become worse. And according to the VA, anyone who suffers from COVID is at risk for developing these symptoms, which currently include an altered sense of taste or smell, maybe a combination of both, tiredness or fatigue that interferes with daily life, a nagging cough or shortness of breath, heart racing, skipping beats, palpitations or chest pain, lightheadedness, dizziness or balance problems, vision and memory problems or headaches, increased anxiety, depression, stress, or trouble sleeping, abdominal pain, or constipation. Anyone who has COVID can develop long COVID, no matter how mild or severe their symptoms were. Now, let's get into some specific periods as far as qualification. So, any service member who developed COVID symptoms during the following time periods may qualify for VA benefits related to their COVID-19 infection. So, if you were active duty of at least 48 hours between March 1st, 2020 and January 5th, 2024, up to 14 days after at least 48 hours of active duty between March 1st, 2020 and January 5th, 2024, on or up to 14 days after active duty for training, Title 10 or full-time National Guard orders between March 13, 2020 and January 5th, 2024. The law says that anyone who has been diagnosed with COVID during any of the above periods of service is presumed to have contracted the illness as a result of their military service. That means that any long-term COVID-related illnesses are presumed to be service-connected without any burden of proof required of the veteran. Notice that, without any burden of proof required of the veteran. Okay, now let's come back to these symptoms of a long COVID, because this is where I want to encourage veterans to think about how they're going about their claims, especially when it comes to COVID related claims, because of course it's only going to be for these long term, long lasting effects, right? So I do want to go over some of these, show you what the VA disability ratings for them are. Some of them I have videos for, and I will plug the videos in when we talk about them. So the first one we want to talk about, let's talk about tiredness and fatigue that interfere with daily life. All right, and note this is military.com that is giving us this information. All right, so research suggests that about 40% of people with long COVID report sleep issues among their symptoms. Problems can include insomnia, daytime sleepiness, which is the big one, waking up several times a night, or not feeling refreshed in the morning. So let's talk about insomnia. All right. With insomnia, you could get a rating of 0, 10, 30, 50, 70, and even 100%. And I've done videos on sleep issues in the past, and I'll definitely plug them either here in the video or later on toward the end. Also, when it comes to hypersomnolence or that daytime fatigue, you can get a 30% rating for that. And if, let's say, you have sleep apnea and you need a CPAP as well, that can be a 50% rating. Now, back to this list. Also, here, lightheadedness, dizziness, or balance problems. Check this out. Up to 30% of COVID-19 patients have been documented to experience neurological problems as a consequence. The inner ear is one of the neurological systems that the virus may attack, and the resulting damage may cause vertigo, and or tinnitus, which tinnitus isn't really a big deal anymore, as you all know. According to the VA, it's a big deal to us because we suffer from it, right? But according to the VA, whatever. Maybe we'll get into that on another video. But vertigo, your balance problems, that's where it comes from. And when it comes to vertigo, you can get up to a 30% rating for vertigo. And if you all would want me to do a video specifically on vertigo, let me know in the comments, and I'll more than likely do a video on vertigo. Other issues, vision and memory problems, or headaches. Guess what? Some people, such as those who suffer from cluster headaches or migraine headaches, can be severe and debilitating. And migraine-like headaches are being tracked as the most common symptom of long COVID. The most common symptom, all right? And yes, migraines are rateable, up to a 50% rating for migraines. And I have a video on migraines specifically, and I will plug it here. And of course, I won't necessarily talk about anxiety, depression, stress, trouble sleeping. Well, trouble sleeping we talked about, but anxiety and depression and stress, because I have videos on the channel for those mental health issues. So I definitely recommend, if you haven't seen them, watch those videos. But yes, long COVID can result in these, according to military.com. All right, and the final one I want to touch on, abdominal pain or constipation. Know what this sounds like? Irritable bowel syndrome. And when you look it up, patients previously diagnosed with COVID-19 are at greater risk of developing irritable bowel syndrome when compared with uninfected individuals. And yes, the VA does rate irritable bowel syndrome up to 30%. And I have a video specifically on irritable bowel syndrome and GERD, and I will plug that video here. So this is the way you all have to think when it comes to your ratings and what you want to claim, because a lot of you all probably suffer from these things. You just don't think to claim it. All right, ladies and gentlemen, that's going to do it for today's video. And if you found use in this content, leave a like on the video. And if you're not subscribed to the channel, go ahead and subscribe. You won't regret it. That way the YouTube algorithm knows that these videos are important and will push them out to more veterans like yourself. Now, for those of you that have those long-term COVID symptoms, I'll put some videos up here that you may find interesting. And as always, take care of yourself, take care of those around you, and I'll catch you all in the next video. Peace.